my shin box, left side shin box, left hand is down, grounding the palm, spiraling that elbow pit out and away so that we feel that shoulder blade packed down and back. Sternum's lifting tall, tall spine. Starting with our hip openers. Nice slow inhale into that crocodile breath, doing that same breath. Exhale, drawing the navel up and in as we lift that back knee slowly up towards the ceiling. Inhale as we let it back down. As we're lifting that knee, I want to make sure that we are not opening up our shoulder. I don't want to move in the upper body. I want to be nice and still through the upper body and chest, only isolating that hip. Squeeze into it at the top. Inhale as we let it back down. We'll do 5 up to 10 nice slow reps. I really want to get that extra squeeze at the top, not forcing it, but just feeling what is that end range and can I pull into it and get a little bit more with each one without going into pain, pinch, or stress. Once we've done 5, nice slow transition to the other side. Again, grounded palm, spiraled out elbow, packed shoulder, tall sternum, tall spine. Inhale into that crocodile breath. Exhale as we nice slow open that back hip. And just like the other side, I want to pay attention to make sure we're not opening that shoulder with the hip. I don't want that shoulder rolling back. I want to keep that chest still so that we're just isolating that movement at the hip. And notice, does this hip feel tighter, more restricted, or is it more mobile and less restricted than the other side? And I want to, again, slow down at the very top, squeeze into it, inhale as we let it back down. We'll get one more, squeeze into it, and then we're going to slow transition back to the other side. Getting into that back hip. Now I want to imagine that inhale breath. As we fill up our crocodile breath, there's also a weight to it that drops into that back pelvic bowl. Feel that pelvis drop to the floor. See if it touches the floor. If it doesn't touch the floor, it's not a big deal. But I want to feel it reach to the floor. On the exhale, it's lifting up. We're reaching that hip bone forward and we're lightly scooping into it. If your sacrum, that bone in the back in between your pelvis, was the palm of your hand, the fingers would be the tailbone. I want to scoop and feel that tailbone reaching forward. The more we're able to do that at that full hip extension, we should start getting a good stretch on that exhale through the front of the hip. We should also start to feel some tightening and contracting in the back, in the glute. I want to avoid shifting weight into that back hip. I don't want my shoulders rocking back. I want to keep that weight on my opposite palm. I want to let that hip be free to be able to reach to the floor. Exhale, actively scoop. As we scoop, squeeze into it at that end range a little bit more. Try to get as much of that stretch in the front and as much of that contraction in the back. Get into it, then inhale as you bring it back down. Once we get 5 to 10 reps, nice slow transition back to the other side. Again, grounded palm, spiraled elbow, packed shoulder, tall spine. Nice inhale, crocodile breath, but also feeling that weight of that breath moving into that back hip bowl. Exhale, lifts, reaches forward and actively scooping that tailbone. Feel that stretch through the front of the thigh. Try to feel that contraction in the rear. And with each one, squeeze, get into that exhale, continue to squeeze into it lightly, trying to maximize that range of motion. How does this side feel compared to the previous side? Is it tighter, more restricted, or is it more mobile and less restricted? And getting an idea, starting to kind of feel which hip is tighter, which movements are tighter side to side are going to be really important as far as assessing our movement. More importantly, with just understanding where we move well compared to where we don't move as well. The areas we don't move as well are areas in which we can get improvement. We'll slow transition back to the other side. We're going to do that same inhale into the back hip bowl, exhale, actively scoop, locking in. I want to lock in that active scoop, that squeezing into it. And then we're adding in a reach with rotation. So as I rotate, I want to spread my hand as wide as possible, fingers wide, extend elbow fully, spiral the palm up to the ceiling, and then rotate through that shoulder, trying to get that rotation. I want to feel that shoulder rotating to extend those fingers as far forward as possible. Inhale, we're unwinding all the way back into that back hip bowl. Exhale, actively scoops, locking it in. Open hands, spread, palm up, extend elbow, and rotate. As we lock in that back hip and spiral, you may feel that stretch kind of move up into the obliques, and then getting in that rotation, we may feel that stretch into that low back. Notice how tight and stiff, how far are you able to rotate? After 5 to 10 reps, we're going to move back to the other side. Again, palm down, spiraled elbow, packed shoulder, tall spine. Inhale into that back hip bowl. Exhale, actively scoop, lock in that hip. Then we're spreading hands, extending the elbows, spiraling the palm up as we rotate. Inhale, unwinds all the way back into that back hip bowl. Exhale, squeeze into that hip extension. Again, I want to feel that maximum contraction in the glute. Continue to spiral, extend, spread. How does this side feel compared to the other side? Does that hip and oblique or low back feel tighter? Does it feel harder to reach? One good assessment to notice is, does it take your breath away more on one side? Especially as you get into that end range, do you feel that tension in your breath where it's harder to exhale on one side more so than the other? Once we get 5 to 10 reps, we're going to switch back to the other side. And now we're going to get into that side body space. So the hand that's been on the floor, we're bringing it off the floor. So I'm in my left side shin box. My left hand is now coming up over the top of the head. I'm going to try to keep the forearm relatively flush with the ceiling. We're still inhaling into that back hip bowl. Exhale as we actively scoop, letting that hip come forward and scooping into it, trying to lock in that back hip. Let's do 3 to 5 reps of just inhale into that back hip, exhale, actively scooping. It may be a little bit more challenging to have that hand up. Body may want to lean. So I want to feel this movement just in that back hip. Once we get to 3 or even 5 reps, once you start to exhale and scoop, I want to start to reach that elbow up to the ceiling, like you're trying to touch the tip of your elbow to the ceiling. Inhale, unwinds, brings that hip all the way back into that back hip bowl to the floor. Exhale, actively scoop, lock in that back hip first, then add that lift through the elbow. Once we get 5 up to 10, reps. We can bring that arm down. Nice slow transition to the other side. Doing that same thing, bringing that opposite, that hand up, forearm flush with the ceiling as much as you can. We're going to start with just that inhale into that back hip bowl. Exhale as we actively scoop. Inhale, let it fill up, dropping that hip to the floor. Exhale, see if you can get a little more squeeze into that scoop. Can you feel more of that stretch on the front and more of that contraction in the back? And again, we're doing 3 to 5 reps. On the next one, as we exhale and scoop, we're starting to lift that elbow up to the ceiling. I want to lock in that hip first and then lift through that elbow like you're trying to touch the ceiling with the very tip of your elbow. Inhale, unwinds into that back hip. Exhale, scoop, lock in that hip, and then add that lift. Once we get 5 to 10 reps, bring that hand down. We're going to move back to the other side. Now we're going to get into our folds. Today with the folds, I'm going to use the arrow of the knee. So I want to bring my shoulders and my hands so that I'm perfectly square to that knee, the angle of the knee. I want my sternum to be lined up right through that knee. So I need both hands on equal sides of that knee. From here, we're going to do the same breath into that back hip bowl, but my hands are down. Exhale, I'm actively scooping that back hip forward, trying to lock it in. And then I'm going to let those hands slide, keeping even and square to the knees so that our sternum moves right through the center of the knee. Inhale brings us all the way back up, unwinding, breathing into that back hip bowl. Exhale, actively scoop as we fold. Again, trying to keep shoulders and chest square with the sternum. Want to make sure those hands are reaching evenly, that we don't have one hand that's reaching further than the other. If one hand's going further than the other, that means your shoulders are not square. I want to keep those shoulders square, which means hands should be even. Again, as we inhale, let that back hip drop. Exhale, scoops, reaching it forward, locking it in, and then that nice fold. Once we get 5 to 10 reps, nice slow transition to the other side. Again, bringing hands even around the knee, squaring that sternum up to the knee. Inhale into that back hip bowl, keeping the hands on the ground. Exhale, actively scoop. Feel that stretch through the front of the hip, glute engaged, sliding those hands nice and even, keeping that sternum reaching through the knee. Inhale all the way back into that back hip bowl. Exhale, scoop, lock it in. Nice exhale as we fold. Now, by staying square to the knee, you may find that one side, it's a lot harder to stay square, that there's more tension in the low back. So that's part of the reason I like this version of the Shin Box folds assessment. We can get a little bit more feel into some of that tension in that low back area, especially if one side of your Shin Box is more challenging than the other side is. Once we get 5 to 10 on this side, we're going to start to go back and forth. Now, as I go back and forth, I'm less concerned about keeping that shin angle. We've got our assessment. We got a good sense for how our back and hips feel. Now we get to explore. So it's just a nice fold. I kind of want to go where it feels good and juicy. Inhale as I come all the way back up. Exhale as I transition across. Inhale as I finish my transition, and then exhale as I fold on the other side. And as we're going back and forth, start to feel the difference. How does that right side fold feel compared to the left side? Is one side tighter, more restricted, more challenging, more difficult to get into than the other side? Is one side easier? Does it feel good, like the side that you want to be on? And is there a side that your body kind of wants to avoid? That would be a really, really important assessment point. As we're going back and forth, we're now going to start to change that shin box angle. We're going to let that back leg start to slide open more. Continuing to get that nice fold. When I fold, I still want to keep the hands even so that my shoulders are staying square. But again, I can start to play with where I explore. I can reach more forward. I can reach behind my knee. I can reach through the knee. We have a few more options of which we can play with. And play is a really appropriate word here. I want to be exploratory. I want to be playful. I want to be in a state where I can discover things. You know, often what we're going to discover is where movement feels tight and restricted that we didn't know was tight and restricted. And that can be really beneficial information. With each one, we're continuing to open up that back hip more and more to what we comfortably can, getting closer to a yoga class pigeon pose. Although I'm less concerned about that yoga class pigeon pose, I'm more interested in what we find with some of these positions of that back leg. When I'm on my right side with my back leg relatively open, this position actually feels fairly easy to me today. I have a little bit of tightness through my right side low back into that right glute. But when I come to my left side and open up into the same position, my right hip, I have more tightness and tension into the adductors. I feel that a lot more right here. Bigger stretch, bigger pull, which is a little bit new. That has kind of flipped on my body over the past few weeks. It was my left hip that was tight in that space, but I've been doing a lot more work to kind of address that, and so it's actually shifted to the other side, which is not unusual for my body.